Hello, everybody. Welcome to another episode of the Erectile Dysfunction Radio Podcast. I'm your producer, Casey, joining you for today's episode, and it's going to be a special one. Diane Spiva is our guest. So Diane is a nurse practitioner, and she's in Johns Creek, Georgia, and I want to welcome her to today's show. And first of all, I want her to tell us a little bit about her background and the role she takes in treating men with different sexual dysfunction issues.
Well, thank you for having me on your show today. I really appreciate that. Yes, my background is, I was a nurse anesthetist before I was a nurse practitioner. Since I've been a nurse practitioner, I've worked in women's health and men's health, but most recently, for many years, I worked in urology, men's health. So erectile dysfunction is one of those areas that is very important and near and dear to me. It's one of those things that all men are going to have happen to them at some point in their life. So I feel like it's important for me to be able to communicate that with men so that they know kind of what to expect and those kind of things that they might do to help prevent that from happening to them, or when it does happen, for them to find that comfort in seeking help sooner rather than later.
I'll get this conversation started by me asking you about what have you learned over the years treating men with erectile dysfunction. I want to hear all about how that goes and what you might tell a potential erectile dysfunction patient who's listening to today's program.
Sure. So what I've learned over the years is that, studies, there's a lot of studies about this out there because it's just important to men. Having erectile dysfunction significantly impacts men's lives, quality of life. It affects their testosterone levels, confidence levels, which in turn affects their overall health. So, it's an important matter to be knowledgeable about. I know that when we read studies about erectile dysfunction, that it's clear that men wait from the time they first start to have symptoms, they wait about 2 to 5 years before they very first seek medical attention. There's various reasons for that, but the primary one that I've recognized is that the very first time a man starts to have some difficulty getting an erection, they 100% of those men have performance anxiety. So it's difficult. They're trying to figure out what's causing that problem, and they do that alone. Men don't typically discuss that with each other. And because of that, they don't really feel like they get a good sense of direction with that. So it's opportunities like this where, your listeners, when they hear that, find that comfort level that, they're not the only one. And what can they do to try to address that earlier? And earlier identification sometimes can be the difference in, how much of a treatment do they have to undergo to keep that erection.
I want to put a scenario in your head and kind of tell me about how you would deal with it. How would you talk to a patient right now who's out there who thinks they are struggling with ED? I mean, you talked about all the years that go by before most men or many men seek treatment. What would you tell that person who's on the fence right now about whether or not they should do anything about this potential erectile dysfunction they're dealing with, but they're on the fence about doing anything about it simply because maybe it's such a personal issue and they just don't feel comfortable talking about it or whatever the reason?
Sure. Usually I just offer, I just remind them that it's okay to speak to a healthcare provider, that it's nothing to be embarrassed about. Again, 100% of men are going to have a problem with this at some point in their life. And it may not be at the end of their life. It may be at the beginning of their life. I have some 20-year-olds and 30-year-olds that have problems with that. There's many different causes of that. It can be, again, performance anxiety. It can be that your testosterone is too low. So sitting and waiting on that at home isn't really addressing those kind of things. But what an erection is you have your penis is a muscle. So like any other muscle, if you have performance anxiety or confidence levels, men tend to step back and they don't know they're going to get an erection. They just don't have sex. So at some point, they start to lose length and girth. which then affects their confidence level. So we don't want you to get to that point where you're trying to regain your confidence and, and regain that length and girth that you've lost. There's lots of different, protocols and tests that are easy to do that can help find the underlying cause of your erectile dysfunction, and then offer you treatment possibilities to help to remedy that. We always start conservatively, the most conservatively, and the whole idea is earlier better.
Awesome. Diane Spiva, we're talking with nurse practitioner down there in Johns Creek, Georgia, a suburb of Atlanta. I want to now ask about communication tips that you might have for a man when they first visit their doctor or healthcare provider seeking treatment for erectile dysfunction. We've established maybe they could be nervous. How would you best recommend they communicate with their provider on what's going on, what's bothering them?
So, just to have an appointment, you can just go in for your annual exam. There's, physically the things that can cause erectile dysfunction may be something as, blood pressure is a major cause. So, high blood pressure can cause erectile dysfunction. So too can the treatment for high blood pressure, those antihypertensive medications, blood sugars sometimes. So it's important for you to have lab work. It can be anything that compromises blood flow. So we look at those things. We look at, cholesterol can be an issue, or anything, just in your common everyday health and wellness. So obviously hormone testing is going to be a part of that. Generally, a lot of insurances, more and more insurances are trying to start paying for testosterone. Previously, they really hadn't been really good about that. They're slow to get on board with those kind of things. You think, because of the consequences of having low testosterone, with the erectile dysfunction and other types of health issues, that they get on board faster, but they're kind of slow for right now. But don't just assume that. Get in there and get to your doctor and let them find that underlying cause and help you to find out what's going to help you.
Let me ask you about some proactive men's healthcare tips that might go ahead and improve men's quality of life, maybe some low-hanging fruit, so to speak, or anything you would recommend men could start doing today or tomorrow to start kind of getting on the better track towards better overall health and better sexual health.
Sure. So, I'm going to focus kind of on that testosterone for that one. So that plays a key role in erectile function and health and your just overall health and wellness. So the things that you can do at home for that are going to be just the things you've always heard about: eating a good diet. So avoiding, those bad carbs. So, when we think of bad carbs, think of anything that has white in it: white sugar, white flour, white rice. Those fried fatty foods, use that air fryer. That air fryer is your best friend. If you're going to cook with oil, cook with olive oil or avocado oil. They have, that good HDL that helps to keep your lipids healthier, so you don't have that high cholesterol. Being active in your life. So think about exercise, both cardio and resistance training. So that means, making sure you're getting plenty of protein to help build and maintain muscle mass. Remember, your heart is a muscle, so too are your erections. So anything you can do to maintain that musculature is going to help to promote that blood flow. To avoid stresses, you are finding ways to deal with stresses. We all live in a pretty stressful world today. So, you may have to find a way to slow down a little bit and just find time for you to kind of focus on the good things in your life. I don't feel like you have to necessarily do meditation, but that is you don't have to get down on, cross your legs and hum, but to focus on the good things in your life. I really like yoga for that, get that stretching in and to learn how to do breathing right. That breathing helps to relax those muscles. So those are the things. And then having sexual activity helps, having frequent happy sex helps to naturally increase that testosterone level. Low testosterone leads to loss of bone mineral density, and which can lead to fractures and health issues as we get older, but also metabolic syndrome, which is, a key word in today's society. It's, that metabolic syndrome is obesity being the center of a triangle, and that triangle being diabetes, high blood pressure, and heart disease. So making sure that your testosterone is a healthy level is going to help to promote, a healthy sex life, but a healthy sex life helps promote healthy lifestyles, health and wellness for men.
Diane Spiva, nurse practitioner, joining us today, talking all things men's sexual health. I just want to give you the final word. Is there anything else you wanted to add to today's discussion before we wrap it up here on ED Radio?
I just want men to understand, and women to understand for their partners, that ED is not something that you have done to yourself. It's something usually that's very identifiable and easily treated with recognition. A healthcare provider should be able to point you in that right direction. There are, certainly, men's health specialists or somebody who specializes, hormone clinics that specialize in ED, such as ours here at Newbert T here in Georgia. We find it's important to us to find out that underlying cause and help you to ascertain what's causing your problems and find better health and wellness. There's lots of treatments besides just Viagra's and Cialises. So get with your healthcare provider and see what you can find out. We're happy to help you here. If you want to contact us here, I'm happy to give you our phone number, if that's okay with you for me to give. Here at Newbert T, our phone number is 404-480-5229. Or you can go to Facebook, and we are at menswellnessleague.com. If you go to that online, there's some information there. But if you click on appointment, it will send an email to us, and we can contact you back. But we're happy to discuss these things with you and see what we can do to help you.
Awesome. Thank you so much, Diane, for your time today.
Oh, thank you so much for having me. I really appreciate it.